Thank you, Mr. Kamoi-san, CEO of Abim Consulting, and of course, Sonoka-san, Managing Director, Nikkei Group Asia. Now, we head to a segment titled Healthtech Strategies for Accessible, Smarter Healthcare. This will be a completely virtual panel. Please welcome Ms. Caroline Riady, Deputy President Director of Siloam International Hospitals, joining us from Indonesia. Also calling in online, Mr. Linus Tham, Group Chief Information Officer of IHH Healthcare. The moderator for this segment will be Shotaro Tani, Nikkei Asia's Indonesia correspondent. Tani-san, over to you.
Right, thanks for the intro, Dylan. So, as Dylan mentioned, our panel is titled Healthtech Strategies for Accessible, Smarter Healthcare. COVID has obviously accelerated digitalization in Southeast Asia, including healthcare. But I think even before COVID, there were quite a lot of excitement around health tech in this region because it had the potential to tackle many of the healthcare problems facing the region, not least easy access to healthcare. So we have today two of the best speakers to talk about this, Linus from IHH and Caroline from Siloam. But we'll start off with a brief presentation from the two. So Caroline, please take it away.
Thank you, Shotaro. It's a pleasure to be here. Allow me to share a little bit about Siloam. Can I have my slides, please? Thank you. Next slide. Just a little bit about the context of where Siloam is. With 230 million people, Indonesia is the fourth largest population in the world. However, with the specialist doctor and hospital bed ratio to 1,000 population, healthcare and especially quality healthcare is still out of reach for many. And the situation becomes even more challenging when we go into the remote cities and islands. Next slide, please. This sets our context for the vision of Siloam. Siloam has the broadest geographical coverage of any private hospital operator network in Indonesia, with 40 hospitals spread across 30 cities. And in a country where talent is scarce, 9% of the country's specialists are engaged with Siloam in some form and another. We are also the largest provider to the National Universal Healthcare Program, BPJS, which allows us to serve those who are economically disadvantaged. The reason for all of this is because we want to provide the best medical care to as many Indonesians across the archipelago. Slide, please. While most of our presence is offline, we are mindful of the growing consumer demand for more convenient, accessible care through digital platforms. And the demand has been magnified and accelerated because of COVID, the readiness from the doctors, from the patients, as well as regulation. Siloam is uniquely placed to be able to contribute to the advancement of medical technology to create better medical outcomes for more Indonesians. We want to leverage our expertise, data, and medical capabilities to deliver healthcare more efficiently and to more people across the country. Slide, please. Siloam has the advantage of being able to provide the full cycle of continuity of care. We're not just a delivery mechanism. The amount of medical procedures we perform, for example, has provided us with millions of data points, which can be used to improve the quality of care. Digital capabilities allow Siloam to transform the whole patient journey, starting from the discovery phase, let's say when patients start looking for the right doctor and hospital, all the way to discharge and recovery. Next slide, please. Investment in technology gives Siloam the potential to maximize each hospital's efficiency and to heighten patient experience, improve clinical outcomes, and increase reach to patients. And this, we are in the journey of doing so through a three-phase approach. The first phase is standardization, which is basically putting the basics in of our digital operations. And as a network of hospitals, ensuring that we have consistent visibility and control across the hospitals. It includes our hospital information system, the ERP, radiology system, lab system, Through digitalization phase 2, we incorporate patient journey and clinical processes into the system. Now, it allows us to redesign these processes. We don't just want to digitize current processes, but as we're doing it, we want to ask ourselves, what is the new way of doing things to be more efficient, consistent, and producing better patient outcomes? This includes implementation of EMR, doctor appointments, and teleconsultation. The last phase is innovation. Now here, we focus on how we can take advantage of new technologies and use them to enhance existing services or invent new services and new methodologies. Which brings me to Siloam's key digital platform, MySiloam. Next slide, please. Siloam has developed a self-service application called MySiloam. Through this application, patients anywhere in Indonesia can access teleconsultations, monitor their health, and assist in managing medical conditions such as diabetes. In addition, patients can book medical appointments and store their medical records through this application. Teleconsultations are incredibly useful for patients who have difficulty commuting to hospital, including those in remote areas. Technology cannot replace the functionality of a traditional hospital, we believe, particularly for medical interventions. However, MySiloam does improve efficiency and enhances Siloam's offline services. Overall, MySiloam has made our medical services more accessible, and as of now, around 10% of outpatient visits are managed through the MySiloam application. We expect that in the foreseeable future, the majority of visits will be handled through MySiloam. That concludes my introduction. Thank you very much, Shatani. Back to you.
Thank you, Caroline. Linus, please.
Yeah, thank you very much, and very happy to be here today as well. If I may have my slides, please. So I'll just give a quick introduction to IHH and what we're doing in the digital space. Next slide, please. So this is IHH. We operate 80 hospitals across 10 countries. And in addition, we also run primary care clinics in Singapore. What ties this whole very diverse group together is our vision to be the world's most trusted health services network. Next slide, please. In realizing the vision, we believe we would therefore touch a lot of lives, and the opportunity to transform care is upon us. And to do so, we have pretty much established for ourselves 3 strategic pillars by which we're going to deliver that. The first of which obviously is trust. We can only touch lives if our patients and our staff trust the organization in doing that in a well manner. So that's key to our entire strategic platform, building up trusts. We also believe we have the unique opportunity because of the diversity and the geographical spread of IHH, that we can build and have a lot of synergies in terms of how we can do things better, more efficiently, improve care, look for new opportunities, and really then get to the ability to transform the care that we are talking about. And fully aware that as we transform care, healthcare itself will also transform around us. We do need to look for new growth opportunities so that in turn, we will be able to touch more lives. So on this growth platform, one key area would really be how do we look for growth in the new digital space? And that brings me to our digital health ecosystem. Next slide, please. To achieve our digital health ecosystem, we pretty much looked at it from 3 perspectives that we need to work on concurrently. The first of which is obviously the foundation. Today, you find IT everywhere in healthcare operations, and we do need to improve our core IT operating systems, tapping on the synergies and the capabilities that we have already within the group to really improve the effectiveness and efficiency of our overall operations. And when we have that, we need to look for new ways, just as Caroline have mentioned. The population today, and in part really accelerated by COVID, is expecting new ways of engaging healthcare providers, not just by coming to the physical facility that we have, but also continually engaging us digitally. So that's how we are looking at having a digital ecosystem to engage them when they're not physically with us, and to facilitate the engagement when they do come in. Doing both the foundation and the digital ecosystem, we generate a lot of data, And that brings us to the third part of our pillar strategy, which really is to build up on our data capabilities so that we can be a lot more data-driven as an organization. One, to improve our processes, to make ourselves more efficient, more effective, improve our ability to transform care, deliver better care, and also be able to engage better with our patients. So the three areas, we are in fact working in parallel. We do recognize that some things have to happen somewhat in sequence, but we are working in parallel. And some examples of this, if you could bring me to the next slide, please. Next slide, yeah. And so these are just three very top level examples of what we're trying to do as part of the three pillars of our digital ecosystem. First of which is a value-driven outcome. Now this originated in the University of Utah. We have adopted this, and it's a way of measuring through our data, how are we delivering good value care to our patients? Are they getting the outcome that they want? For example, if they have a hip surgery, are they able to play basketball in a week? Or they're never able to walk properly. I think the value is when they are able to walk properly after surgery with us. So we're using our data and our foundation platform to enable that. I mentioned we're extracting synergies through adopting our Cerebral Plus project that goes into our core foundation as a product that has been developed over the last 20 years and constantly maintained and kept up to date, and also putting in more IP through inputs from the rest of the group into it. And we've deployed that in Turkey, in Malaysia. We're working to deploy that in Singapore. And accelerated by COVID, we started dabbling with telemedicine, but really with COVID, in response to the need to continually support our patients' care in 2020, during all the lockdown, we rolled out telemedicine across all of our markets. I think we started that when the lockdown started around March in 2020, we got it all up in by April for everyone. So these are just some high-level examples. Next slide, please. But it's not about just putting a lot of tools and capabilities and functionality out there to digitalize or digitize parts of our business. What we're trying to do, make sure we do, is always remembering the consumer is at the center of all that we do. We have to design the experience wearing the lens of the consumer so that we are really able to deliver the consumer-centric mobile-first care for them so that they have a seamless experience with IHH. So I think with that, I'll just close my presentation and we can go into the discussion. Thank you.
Thank you, Caroline and Linus, for those high-level overview of digitalization in health tech. I just want to start off our conversation with some granular details, especially around the investments in health tech companies that you both have made. So Caroline, if I can start with you, you obviously talked about your My Siloam app, but I understand through your incubator you've obviously invested in other health tech companies. So can you just talk us through that and just explain why you made those investments?
Mm-hmm. I think for us, our first priority and focus is, of course, laying a solid, dependable digital system foundation, which is, I spoke about, Linus touched on as well, the HIS, the EMR, because hospitals should not underestimate how much we can gain from it, as well as the amount of effort and change management needed for a successful implementation. Now, however, we have started making investments to innovate, which was a phase 3 that I presented on. And one of them is an investment that we made in Prixa, which is an artificial intelligence-based diagnostic tool. I'd like to pull up that slide if you don't mind. Can somebody pull that slide up? Okay, no need to.
We'll just give them 2 minutes.
No. So anyways, if we get the slide, that's fine. So it is an artificial intelligence assisted medical diagnostic tool where its primary function is to precisely process data and narrow down medical diagnostic options from a patient's symptoms until the patient's medical condition can be accurately diagnosed. By using this AI technology, the patient can then be referred for the correct treatment procedure and appropriate specialist. This tool assists doctors in making highly accurate and efficient diagnosis. And I think that's important to note because for a while, I think that healthcare kind of thought that with these AI tools that suddenly one day we wouldn't need doctors, which is far from the case. And so these AI tools are tools to make doctors more efficient in what they do. We believe technologies such as artificial intelligence will play a significant role in the future of healthcare. And AI can provide insights by processing large quantities of data, spot patterns that may not be obvious through human observations. The strategic investment we made in Prixa is one that we see to be quite successful, and in fact has been adopted into the government ecosystem in an app that they launched, which is called Fit Aja.
I think the key point there is it assists doctors. It doesn't make decisions on behalf of doctors, right?
Mm-hmm. Yes, absolutely. At the end of the day, the clinical decision making or coming to the right diagnosis cannot just be seen through one perspective only. I mean, you've got to have a physical examination. You got to look at the epidemiology. You got to look at the patient's experience and what they're saying about what they're feeling. So it really does have to take into consideration all of those things. And so these tools only assist the doctors, and we still need doctors to make that final decision, especially because healthcare is very different to a lot of industries. And it is very different in two ways, let's say to a e-commerce or a e-finance. Number one is that in healthcare, when we go to a Shopee, right, we're going to compare different products and we're going to decide for ourselves what's best for us. But in healthcare, you have somebody else decide for you what is best for you. And that's number one. And of course, number two, the huge emotional aspect of providing healthcare cannot be replaced by an app or a digital tool.
Good point, good point. And Linus, IHH, as I think, made public, well, you might have invested in some other stuff, but at least publicly, you've made, I think your latest investment was in a teledoctor startup called Doctor Anywhere. So can you just take us through your decision and why you made that investment?
Well, I think for us, as I mentioned, our vision of being the world's most trusted health services network, you do need to look at the entire environment and how does the network come about. Really, COVID has brought up to the forefront that healthcare needs to be looked at in a slightly different way. The traditional way of just looking at things as a hospital care or a clinic, disjointed episodes can no longer happen. So the developments in technology, in fact, is transforming care as we speak. And IHH wants to be really at the forefront of that and looking at how do we engage more and push care downstream. So by incorporating that, we really provide a mechanism whereby we ourselves can put together a network, but at the same time, the ecosystem doesn't have to be all provided by us. And we could bring partners into the ecosystem so that our patients and our consumers really have access to the best care. And that's kind of what led us to invest with Doctor Anywhere, because we see them as a suitable partner addressing a need for our patients. And we can work together with them to bring them on board as part of our digital health ecosystem. And that really, at the same time, we're also just not going out and investing and bringing more things in. We will be quite remiss given the fact that we ourselves have so many units across the group. So that's why we are also building up on our own in-house capabilities and complementing that with the investment. So we're investing internally as well as externally.
Got it. I just want to stay on the topic of telemedicine for a bit and use that as a pivot to the potential hurdles and challenges that Healthtech faces. So obviously, COVID has meant access to healthcare facilities have been severely restricted, but even people living in the remote areas, even before COVID, access was restricted, and that's I think where teledoctor was really hyped up as a solution for them. But let me just play the devil's advocate and pose this question: do you think teledoctor is essentially a solution for the urbanites? Because the rural people can maybe talk to the doctors via an app, But at the end of the day, they really do, if they need a treatment, they would need to go to a proper hospital, right? And the people who can go to those hospitals, at least in Indonesia, is mostly restricted to the urban population. So it's one of the challenges in health tech, that it's more a service for the urbanites and it kind of leaves out the rural population. Linus, do you want to go first?
Well, I wouldn't say we're leaving them out. It's really the use case that you implement. So if we look at our setting, we're not in Indonesia, so we don't have the same challenges that Caroline have in Indonesia as a market. But take India as an example. India has very diverse capabilities, even in a given very well-developed city in India. Those of us who have been to India will know that you just cross the street, you're in an entirely different world. So it's not just about access to doctor. There's a whole range of rehab that you could provide on a telemedicine capability. You could look at consultation, counseling. So it's not limited to urbanites. It's location specific. It's things that you can actually do. And it's a complementary service. For example, if it's a follow-up appointment, after the consult, the doctor can say that the patient is sufficiently stable, and you could arrange for delivery of repeat drugs, or you could arrange for someone to visit the patient. In some of our units, in fact, we have looked at dispatching phlebotomists for lab draws at the homes, because the patient can't come forward, and then the lab tests are done and the doctor does a teleconsult to review with the patient.
I have to agree with Linus. I think that digital capabilities, in fact, allows us to bring healthcare to where the patient is, and it's not confined within our brick and mortar hospitals. And so we're able to bring healthcare to those remote areas. In fact, one of our clients is a large managed care provider who is working with us because they have clients in remote places in Indonesia. So they have staff who they've deployed to remote places in Indonesia, or don't stay in one city, and they need that service to be available to them all the time. And therefore, they have subscribed to our telehealth services because of that. Now, I think that another benefit is sometimes we also miss this part of telehealth, but telehealth does not always have to be a doctor to consumer, a D2C. Sometimes it can be a D2D. So there are times when some of our doctors in some of the remote cities would consult the doctors in some of the larger cities, and therefore we were able to bring this expertise to some of these remote areas. And one specialization that we've done this quite successfully is actually radiology, because in radiology you can send the images and can be read by another radiologist somewhere else. Now it works very well because Indonesia has a large scarcity of radiologists, which can result in poor quality reading results, and it's also inefficient in the time it takes to receive the results, especially for those who live outside of traditional economic hubs. Through our IT infrastructure, Siloam has connected 38 radiology centers. So for example, a patient can have a CT scan at our hospital in Kupang, and it can be read and analyzed by a radiologist in Jakarta, and provides valuable training opportunities for upcoming radiologists. So it leads to better patient outcomes, especially to those in areas of the country where there are significant skills shortages. So I have to say that digital health benefits those in rural areas, and it should.
Good point. And I want to talk about another thing that Linus touched upon, which is data. Obviously, you have 80 hospitals in 10 different countries. Siloam has hospitals across Indonesia. As you digitalize your operations and interactions with patients, you are going to have a lot of data. But the flip side of that is that you're going to have to pay a lot more attention to protecting that data. And in Indonesia, we had massive data breaches with BPJS, which is the state insurance scheme, and that's been one of the issues of digitalizing societies. So how do you deal with this issue, Caroline?
It is a huge issue because in Indonesia, the demand and the speed at which digital is progressing is much faster than the pace of cybersecurity efforts and cybersecurity laws and the government being able to crack down. And you rightly said that there's been a huge breach. Actually, there have been two breaches in Indonesia. One was through BPJS, another one is a leak of COVID patient data, a few million of them. So it is a big concern, but I do believe that these incidents will make our country more aware and more vigilant towards these kind of attacks. We do spend quite a bit of time looking into our cybersecurity, making sure we are doing the right thing. At the end of the day, nobody is immune to it. And we do a lot of education towards our staff in what they need to do to protect patients' privacy, patient data, and not sharing passwords, because we know that the majority of attacks that are successful are because of human error and because somebody's left their password or their computer screen open and not really some kind of sophisticated breach. And Linus will be able to say more on this, but it is a concern. And we also are sad to see that there are people in this world who would take advantage of the situation and take advantage of people who are sick for their own personal gain. It's really sad and sickening to see.
Yeah. Well, yeah, Linus, going on to your data security, you obviously need to pour a lot of capital and resources into those areas. What are the steps that IHH is taking right now?
Well, we certainly have a lot of concern around data security and cybersecurity, and fortunate thing is that is something that has been actually embraced as a very key priority by our board all the way up and down the chain of the organization. So we have been upping our investments. We have been looking at setting up, and we have set up centers of excellence for cybersecurity to really improve the robustness. But as Caroline said, the biggest challenge really with all the technology that we can put in place to improve the security, the weakest point often is how our people handle their equipment, deal with their passwords, whether they connect in a cafe and try to access a VPN or have even the screen open or not watching as to who's overseeing their what they're doing across their shoulders. So those are things that we really are paying a lot of attention to make sure that there is a lot of awareness, a lot of training, a lot of reminders, whilst we put the infrastructure in place to protect the networks and the environments, as well as to make sure that we have the ability to turn around and try to resolve and limit the damage should anything come in. So thankfully, so far, we've been very fortunate, but I think we're taking a basis of, it's not a matter of if, but a matter of when. So we just make sure that we are constantly ready for that event of a when.
Got it. Just want to change tack a little bit and move to the fun section of our chat, which is future gazing. Future gazing is always fun. There's been a lot of buzz around VR, AR, MR, and metaverse, as well as AI and blockchain, obviously, a whole host of different technologies that are being hyped up right now. So Linus, Caroline, can you pick one or two technologies, even the ones that I haven't mentioned yet, can you pick just one or two technologies that you are very excited about and how that applies to healthcare in the future? Let's start with Linus.
Okay, yeah, but let me just talk a little bit about the combination of VR, AR, metaverse. I see that really as a huge opportunity. It's an amalgamation and a combination of many things that have been developing over the years. Years ago, we have Second Life, but now as we talk about digital engagement, about having the patient digital access apps, and telemedicine, teleconsultation, enabling and training the patient as to how to do their own rehab at home. The combination of AR, VR, and combined on a metaverse environment will give that very unique engagement opportunity that we can have with our staff and with the patients, and really look at further transforming how healthcare is delivered. away from just the bricks and mortar, but complementing. It will not replace the bricks and mortar, but it will complement and bring us really into the home of the patients, and so that we're there all the time and being able to be constantly walking the journey with them to improve their health.
Right, Caroline?
Yeah, so I think that these capabilities provide new methods to deliver care. So we'll still be delivering care. In 100 years, we're still going to be delivering care. It's just how we're going to be delivering care, right? Before the internet, we had flyers and brochures and we had education booklets, and now they've almost disappeared and everything's become online. So it's not that we're not providing healthcare, but it's really in a different way. And so one day we hope to have a metaverse, a hospital, and there are a lot of services that can be provided in that kind of form. Think about psychiatry and psychology, for example, being and some of those people might not want to be leaving their homes, and so being able to feel like they're sitting in front of a doctor, sitting in front of somebody counseling them, except not leaving their home, is something that's going to be very, very powerful. All in all these digital capabilities are new possibilities, new capabilities for healthcare. And I think that it's up to us to see how we can maximize the use for it. At the end of the day, it's not jumping to the newest invention or the newest bells and whistles, but really thinking about how it can add value to the patient journey, to the patient experience, to patient outcomes. And that's how we see it.
Got it. Can I just talk specifically about wearables? It's not one of the technologies that I mentioned, but wearables has been on my mind for a while, because when Apple Watch first came out, or Fitbit first came out, people were thinking, hey, if this fitness tracker can track my body conditions, then it's going to be very good for preventative care, as well as if you are sick, you'll get the early symptoms and you can go to hospitals right away. That was the dream, but it hasn't happened yet. And in Southeast Asia, I talked to some health tech startups as well, but they were saying we're going to utilize wearables, and this is going to link to an insurance scheme. And if they're living a healthy life, it's going to reduce the insurance. Those kind of things have been said for a while, but it just hasn't. Wearables, especially in terms of healthcare, hasn't really taken off. So I was wondering where you two stand on this wearable, where it goes from it. Are we going into that dream world where preventative and after you get sick healthcare, that kind of thing is integrated into the wearable space? Or are we going to see just wearables being used as, oh, I got a WhatsApp message, I got an email? Linus?
Well, if you remember my last slide, and I said about putting the consumer at the center, why we believe that wearables will have, at least personally as a CIO, speaking as a CIO, I believe wearables have a part to play. Where we have faltered is that a lot of these technologies, wearables or tools or all the things that have come up, the way some of them have gone about it is that this, you pretty much gotten a hammer and everything looks like a nail. What we have to do is put ourselves really in the shoes of the consumer and see it from an angle of what do we need to do and how do we bring the whole ecosystem together in an integrated manner, in a network that is there to service and to support the consumer. Then the wearables will work. I think that's really how I would say it should work. And there is a space for wearables, but it cannot sit by itself. It has to be integrated into the health services network.
Got it. Caroline?
Absolutely. I think Linus took the words out of my mouth, but absolutely. Now, wearables is not a new thing. We've been using spider halters to monitor heart for many, many years. The difference is that wearables in the past have been medical devices used by medical professionals, interpreted by medical professionals. Now, what Apple and everybody else has done is put that into the hands of the patient. So again, wearables is not something new, but it's now available for patients to use and for them to monitor their own health. Now, coming back to Linus's point about the ecosystem, I completely agree. And this is the thing is with healthcare is there's so many stakeholders, and unless all the stakeholders are aligned, then sometimes we have a wonderful innovation, except it doesn't seem like it's really gaining traction. So I call the health ecosystem the 5 Ps, and you might have heard it: patient, provider, physician, payer, and policymaker. And so unless all of them are aligned, sometimes then these innovations fall through the cracks. So for example, let's say a wearable, the problem is now the wearable is not connected to, let's say, the EMR. But what if the hospital connected the wearable to the EMR? Then, of course, it will gain more traction. But if the payer didn't cover anything coming out of the wearable, then people will not be motivated to use the wearable, and the doctor would not be motivated to use the wearable. But if the payer covered and the doctor didn't trust the wearable, then it will. So everybody kind of has to be aligned to this. Now, one thing that we've done in the area of, well, not quite wearables, but a broader category, which is IoT devices, is glucometers. I mean, those glucometers have had IoT capability for a long time, right? I mean, they're just sitting there. And so what we've done is we've connected them to our system. So now whatever the patient tests at home, then that data gets integrated into the medical record.
Got it. Thanks a lot for that. We're just about 10 minutes away from time. So final question from me before we move on to Q&A session. Can you both, again, part of future gazing, can you look maybe 10 years from now or even 15 years from now and paint your dream picture of healthcare in Southeast Asia? Starting with Caroline.
I think that 10 years is a long time. And I think that if anything has taught us through COVID, that anything can happen and things can change overnight. Predictions fail. And so I think that we're wary of making these predictions. But I think that in 10 years, I think that for Southeast Asia, and especially I speak for Indonesia, I think a few things would have happened. One is that the GDP of Indonesia would have grown. And within the GDP, the percentage of healthcare spend, which is now around 3.5%, would have grown significantly, probably not to where the US is, but grown significantly. And therefore, access to healthcare is better. Indonesia is a very lucrative market for investors. And we will see global players coming into Indonesia to become providers in Indonesia. Now, the government continues to talk about this demographic bonus where we have a huge productive population coming up the pipeline. Now, that can only happen if we also get our healthcare right. So the government is focusing a lot on healthcare. Now, also with the plans for them to allow not only foreign investors, but foreign doctors into the country, I think that healthcare in Indonesia can only go north and will completely flourish with the use and proper adoption of technologies. Then our dream is that in 10 years, Indonesia will be a place where healthcare is much more accessible to where it is now, which really is the Siloam vision.
So people don't need to go to Singapore or Malaysia to get their healthcare.
They already don't have to, but I know that's a different topic, right? Linus and I, this is one topic where Linus and I are probably going to be sitting on different sides of the table, which I can talk a little bit about that as well, but not the topic for today.
Yeah, Linus.
An upside in that area because of COVID, right. And Linus knows that.
Okay, that was a cheeky question from my part. Linus, your ideal healthcare in Southeast Asia in 10 years' time?
Yeah, so wearing my hat as the CIO, on one front, I see IHH as being our patient's constant companion in a 10 years time frame. That we will always be supporting them for all of their health needs. In the digital space, there will be a digital twin of the patient, engaging with the digital twin of IHH in cyberspace with all the technologies we spoke about. We see that the experience should be seamless, even if they have to visit our facility or after they visit our facility. We could deliver drugs and the delivery could be done by drones right to their doorstep. Across the whole of IHH, and not just in Asia, we believe we will be able to bring all of our resources to care for patients anywhere in the on the globe. We may even partner with Caroline, where the patient doesn't have to leave Indonesia, but we have visiting consultants visiting through AR, providing joint care with them. We could have someone with biopsy slides read out of a biopathologist in Turkey, or ICU patients will be monitored remotely, continually by AI engines and alerted, people alerted when there is a need to do so. So on top of all of that, we do believe digital technologies will allow us to move care further downstream, really transforming the entire way care is delivered. No longer just only done at hospital, but complemented in primary care, at the home, by all sorts of means, having machine learning models so that we really optimize the ability to care with minimal resources depending on the market, like as Caroline mentioned, the doctor-patient ratio. Right, so if you can apply AI to take away the simple work, then indeed the doctors can spend more time in the more complex work. So, and that will also allow us to push more complex care that currently may have to be done in the hospital down towards the GP level, so that people will have greater access to care, more care at a distance, telemedication, physiotherapy, and all that. And your point about wearables and the whole range of medical devices and consumer devices, the patients can then be more empowered to provide and practice self-care, supported by the healthcare system, rather than now it being done on them. So I think that is the 10-year vision that we believe is achievable technologically. But as Caroline said, all the 5 Ps have to align.
Got it. Thanks a lot. We think we've got time for 1 or 2 questions. Question that came through: how do you prepare not only doctors but also staff and less educated patients to be able to use modern technologies? Either of you want to take that?
Yeah, it is a challenge. It's relearning a whole way of doing things. Most of our doctors don't type with 10 fingers. How do you fill out a whole medical record? So I think that our staff have relearned doing things digitally as we implement system by system. The transformation takes time, and implementation takes time, and learning takes time. So the good thing is, if we start now and we take it step by step, then our staff can learn step by step and they can be equipped. But it does have to be deliberate, and we have to really think about what kind of skills they need.
Linus, do you want to add?
Yeah, I fully agree with what Caroline said. And within ourselves, I think in terms of implementing new technologies for staff and doctors, in fact, oftentimes the technology is the easiest bit. Change management is a much more difficult part of the whole journey. And therefore, it's important to engage them early and to support them through that journey. Even more so will be for the patients, making sure that we have the various platforms and always remembering to see things from their eyes, to build it in such a way that indeed it is as easy. One thing is really how, and that's where I guess Apple has been successful, where I remember my late father, we could never get him to touch any technology, but he was flipping away his iPad when we gave him one. So it has to be that easy. We have to remember and design in such a way that it is that easy, but at the same time, having the ecosystem to support them.
And I think that it's also important to be able to monitor this progress so that we can see where it's not moving. We do monitor adoption rates of EMR, e-prescription, appointment system, and all that. And we do set these things as KPIs for hospital leaders for them to manage the transition, even though it does take time. And when they are successful, we do celebrate with them. And nothing succeeds like success. And so when they've seen their own success and that they can do it, then with each subsequent system, then it becomes easier every time they have to change the way they do things. And then it just becomes part of the culture that the industry is changing, and therefore we have to change as well.
Great stuff. I think that's it for our time. So thank you very much, Linus and Caroline, for joining.
Thank you.
Thank you, Shotaro.
Thank you.